we had a chance to interview Eric Borchert from Tandem Diabetes, a local tech organization, healthcare and tech organization that is still hiring during the pandemic. And look for that episode later on this week, wherever you consume your podcasts. A couple of other events coming up on the Tech San Diego calendar in the next couple of weeks. Jerome Ryan, Risk and Resilience Executive from BDO, will be giving a webinar next week on the return to work in the new normal. He'll be discussing what a return to work plan will look like, and we hope that you can join us for that event.
Nathan, how are you?
I am good. Kevin, how are you?
You must be meeting with important people. You have a tie on.
I do have a tie on. I went, I think 41 days without wearing a tie, and sadly it has come back.
Well, I don't know if that's good news or bad news. Let's go ahead and start our webinar. So greetings. Those of you who have been in the waiting room for a while already know this. My name is Kevin Carroll. I'm Executive Director at Tech San Diego. And like most of you, I've been tracking, from a kind of a national and even a state level of what's going on. And one of the things that I've been appreciative of is the leadership that Supervisor Nathan Fletcher has given, at least in the region. He's really been the face of relaying information on what's going on in the county. So first, Nathan, I want to thank you for that. A lot of us are really relying on you to relay that information. I watch your feed every day when it comes up. I put that on my schedule, and I try to watch that religiously.
Thank you.
And so, what I would like Nathan to do is I would like to have Nathan kind of walk us through kind of the state of where we are right now in San Diego. And that's going to take 15, 20 minutes or so. And then I'd like to have a brief discussion with Nathan about how we're all going to get back to work, what that might look like, what it might not look like. So I know you're really busy. So with that, Nathan, why don't we go ahead and turn it over to you? And if you have any technical questions on sharing your screen, Sarah's on standby, and we'll go from there. So I'm going to turn it over to Nathan.
I think Kevin, what I'll do is kind of walk you through the state of where we are, and then a little bit of the thinking for how we move forward, and then would love to just take questions and kind of address any specific things you have, or any of your folks who are on the call be able to address any specific concerns they have. I want to start off by just saying that the challenge in confronting the realities we face when it comes to COVID-19 is we are dealing with something about which we just don't know as much as we would like. We know more today than we knew in February, and we knew more in March than we did in February. But it's been a challenge. I mean, the fact that it is a novel coronavirus, it is brand new. 19 being the fact that it was not discovered until the end of last year, has brought us to the situation we are in. And it is a reminder that from a public health standpoint, in the absence of a vaccine or a therapeutic treatment, a contagious disease has horrific impacts for a society. I've read a lot about in the last 3 months about 1918 and the flu that they encountered there, and the kind of stark realization that many of the things that we are doing to deal with coronavirus are the exact same things that they did in 1918, because in the absence of those pharmacological interventions, being a vaccine or a therapeutic treatment, you're left with non-pharmacological interventions, which are things like physical distancing and face covering, and stopping mass gatherings and the such. I will say, as a region in San Diego County, we moved much earlier than perhaps any other region in California. We were one of the very first counties. We actually declared a public health state of emergency before we had a single local case. And the reality for that was we recognized the danger presented to us, but we also recognized some of the very real challenges that San Diego County faces as a region. Those being an international destination, the world's largest border crossing, a significant population of military, along with the interconnected nature of what we faced. And so it would be much harder to control the spread than say a rural community in Iowa. And so we declared the public health state of emergency. We also had a little bit of a head start in our response in that we took the federal repatriation flights from Wuhan, China, who came here, which gave us time to activate our hospitals, our surveillance systems, our monitoring systems. We also took the flights of Princess Cruise Line. We've taken now 7 or 8 different cruise ships, and then the ongoing challenges we have with the very dire situation in northern Baja. But on the whole, we have done incredibly well. We had a presentation yesterday from researchers at UCSD who used the mortality rates and infection spread not as a projection, but as what's actually happened in other areas, and projected that had we not done what we did when we did it, we would be at 12,977 deaths today, which is the equivalent of the entire city of Solana Beach. Having said that, the things we've done as a state, nation, world have created indescribable economic distress and challenges surrounding that. And so the question is, how do we begin to come out of it? Because again, absent a vaccine or a therapeutic treatment, we are going to be dealing in a mindset of containment in terms of containing the spread. And the aim is to limit the spread of COVID to a threshold where you can maintain the integrity of your healthcare system. You don't want your healthcare system overwhelmed. You don't want situations like they had in Detroit or New York or Italy, where folks are dying in hallways because there is no health system capacity to meet them. We don't want that for COVID patients. We also don't want that for any other patient who needs to access our healthcare system. And so what we think about in terms of the ability to begin to reopen, and I want to clarify that when it comes to jobs and essential businesses, that presently is a decision of the governor. The governor put out an executive order on what's essential businesses. We think we're going to get a little relief from that on Friday with some segments of retail that can do curbside. And there's a possibility that counties can move a little bit on their own pace, a little deeper into stage 2, if they can certify compliance with some as yet to be shared criteria. So we don't know that yet. But the governor presently outlines what jobs can be open at what time. But as we think about our ability as region to move forward, we look at a number of things. We look at the the number of emergency room visits with COVID or influenza-like symptoms. That is probably the best real-time metric of what is happening in the community. And so we track that on a daily basis. We've been on a 14-day downward trend and trajectory because we have slowed the spread of coronavirus. We've also significantly slowed the spread of traditional seasonal flu because the things you do to not get coronavirus are the same things you do to not get the flu. That is an encouraging and positive stat. The number of positive cases per day is completely irrelevant at this point because we are seeing a significant increase in testing. And so we, a number of weeks ago, shifted away from a focus on the number of positive cases to the percentage of positive based on the total testing reported that day. As we do more testing, we're going to get more positives. It doesn't mean there's wider spread. It means we're more aware of what already existed. And so we are tracking those. Right now, we're averaging, our 14-day rolling average is about 6.6 percentage of every day of tests we get back are positive. We monitor that. That number is not as precise a metric as I like because there is testing bias in terms of who you're testing, where they're coming in. And so it is a metric it is better to see as a percentage of positives, but it is not necessarily the best reflection. I prefer the ER visits exhibiting influenza-like symptoms is a little bit cleaner one. But one of the most important ones, and we track this and report this every day at our 2:30 media briefing, is how many people are presently in our regional hospital system. These are all of our regional hospitals report out to us each day. How many are in an ICU bed for COVID positive or COVID suspected? How many are in a general hospital bed for COVID positive or COVID suspected? We look at the two of those together. And then just as important is then we look at those two plus everyone else who is in a hospital bed. And what is that delta between that total current bed occupancy and the regional hospital bed capacity? That is what we have to be mindful of not getting too close to. And that is what is the best indicator. All of those indicators I've just outlined tell us we are doing very good as a region. tells us we are in a position to begin turning the dial and loosening some of the restrictions that are in place. But as we loosen those, we have to do it thoughtfully, we have to do it methodically, and we have to do it in stages, because the problem with the disease that is rooted in exponential growth is by the time you have a massive outbreak, it is too late to do anything about it. And so we have to gradually and gently come out of those, taking a step, monitoring the impact, taking a step, monitoring the impact. And we are operating under the assumption, because a fair question says, if this was so dangerous that we had to stay at home and not leave our houses, how is it we could begin to come out, given it's still there and we still don't have a vaccine? Well, what we are banking on is that we have all changed our individual actions. We've changed the way we go about our daily life. We understand the importance of physical distancing. We understand the importance of something as simple as hand washing. If you touch a surface and coronavirus was on that surface, it can get on your hand. It will not infect you through your skin unless you touch your mouth, your eyes, or your nose. But if you wash your hands, you will kill the virus and it won't infect you. Things like face coverings, which have a significant impact in your ability to transmit it to someone else. And if you're symptomatic, you can transmit it. Even if you're asymptomatic, you can still transmit it. So those are all the things that we want to put in place to come back to what I would say is a new normal. New normal being a way that we can begin to get some of our jobs back open. We can be able to get some of our childcare options back open. Understanding that we're not likely to go back to mass gatherings with 40,000 of us at Petco Park or concerts until such time as we have a vaccine or a therapeutic treatment. The other key foundational part of this, and this is something I spend considerable energy on every day, is what we call our T3 strategy. This is around testing, tracing, and treatment. And this is a vital component of the ability to begin to come out of this. At the beginning and early days of this, we had very little testing at all because it just did not exist. It was a new virus. There were some challenges out of CDC, and it just simply wasn't available. Every day, we are moving significantly to increase our testing. When we have daily rapid testing, and by this I'm talking about the PCR diagnostic testing, not antibody testing or serology testing, that serves a different purpose, and there are some challenges with that. We're talking about PCR testing. As we have the ability to rapidly test every individual in congregate care settings, every individual at high risk, essential healthcare workers, and every individual who has any symptoms at all. If we test you rapidly and we get a result rapidly, then we can isolate you. You can isolate at home by yourself, or if that's not an option, we have close to 2,000 public health motel rooms. We can provide one to you. You can isolate there. That's the testing part. The tracing part is then we go to you and say, who are all of your close contacts? And we immediately reach out to each of those folks and we get them tested. And we stay in contact with them day 1, day 7, day 15, or do you have symptoms? And the aim there is that you can stop any outbreaks or spread, not stop them. You can mitigate them, you can contain them by rapid testing, tracing, and treatment, making the isolation rooms available. We've set an initial goal as a county that we want to initially, as our floor, be able to do 5,200 tests a day, every day in San Diego County. That's based out of a Harvard study that suggested you needed 125 tests per 100,000 residents. So for us, that'd be, I think it's 5,186. We just rounded up a little bit because 5,200 is easier to say. We are rapidly advancing on that goal of getting to that. Now, at that goal, if we assume a positive rate of 8%, which is high, it shouldn't be 8%, based on the number of hours contact tracer spend tracking down each person, we think we need an initial tranche of about 450 to 500 contact tracers. We're at about 160. It's 20 more than we had yesterday. We opened up a portal. We've had more than 1,000 people apply. We're going through that. And these are the individuals that do the blocking and tackling every day to identify positives, identify close contacts. So our hope is that we can come out of this in a way, understanding it will be limited, it will be different, it will not be normal, it will be a new normal. But we can do it in a way where adherence to physical distancing, utilization of face coverings, things like temperature checks. When I show up to the Emergency Operations Center here every day, I get my temperature checked before I'm allowed to come in. If I ever was over 100 degrees, then I would have to go home and I would get tested. So temperature checks, all of these different types of things that we're talking about doing are the kind of essential components of the new normal. And then we daily monitor all of those statistics that I outlined to look at what is our compliance, how are we doing. When we get warning signals, then we might stop any further turning of the dial. We might alert the public. We need to recommit ourselves a little bit. We might trigger surge capacity in our healthcare system. And then unfortunately, at some point, if it gets too much, then we might have to dial back. I would really hate to do that. The unfortunate lesson of 1918 is most jurisdictions that had really significant first waves and saw significant numbers of death, they took action, they crested, they came down, and then they lived in a different state because they had really been made aware in a deeply real way of the danger to this, and they did not see significant waves. The unfortunate history we're fighting against is that most jurisdictions in 1918 that started early like we did, took action early, did not see a big early first wave, which we did not. They came out too early, they came out too fast, and they lost the connection between the actions they take is what gave them the success they had. And they saw second waves that were exponentially greater, and they ended up reimposing a lot of those measures. That's what we would like to try and avoid. So that is it in a nutshell in terms of what we have. I do think, Haiti, do we have those charts on this computer? Kevin, I think I can pull up some of the charts I just referenced and walk you through them if that would be helpful.
I think that would be helpful.
So these are just a couple. We've got a lot more, but for time's sake, I'll just kind of walk you through. Let me start here with this one. This is our testing, tracing, and treatment. So here you say every day we're measuring the number of tests we've done for the day. So yesterday we did 2,306. Sometimes earlier in a week it lags a little bit from the weekend, but that's a daily goal. We want to get to a 5,200. I will say 7 out of the last 8 days we did more than 2,000 tests per day, which has never happened throughout the duration of this. We've done 63,477 total tests reported to us. At the outset, we were having a problem getting entities to report the testing to us. We've done more than that, but that's what's been reported. To put in context, San Diego County is about the same size as Orange County, and we've done twice as much testing as they have done. But we haven't done as much as we want. Our contact tracers, right now we have 160 individuals out there who are doing this case investigation, contact tracing. This is going up every single day as we hire more, onboard more, train more, get them out there. We've done over 5,000 investigations have been performed to date. And then presently we have 189 individuals who are utilizing our public health motel rooms. And this is just for individuals who can't isolate at home. That's just not an option for them to be able to isolate at home. So we make the room available. We had one, they're a firefighter and they live in an apartment with 5 people. They can't reasonably isolate at home. We give them a motel room, but this is available to any San Diegan who needed it. We've done about 568 cumulative. Most people decline that, they prefer to go home. This is what I was talking about when I was talking about percentage of positive. So this chart's a little complicated, but it's not complicated, it's a little jumbled, but it's a better way to reflect. So yesterday, for example, we reported 140 positives, but that was out of 2,306. So that was 6% total. 6% total doesn't concern me. That's right in line with where we're trajectorying. We'd like it to be going down as long as it's flat or not going up. That is encouraging. And then you contrast that with, let me find this day. I remember this day vividly. We had 109, but out of only 1,000, that was 11% positive. Now, one day does not make a trend. One day doesn't tell you anything. It's over time. But what we're really looking at here is we want to see the total number of tests continue to go up. Here you can see 7 out of 8 days are better than we've ever had. You do get spikes. Sometimes this day the VA just dumped like 1,500 test results on us in one day. But the general trajectory of the teal line there is important to us. And then what's most important here is this rolling percentage of where we are. And so we spent a lot of time looking at this one. The second one is one that we spend a lot of time looking at. This is ICU utilization in our hospitals, and then non-ICU hospitalization. So ICUs are a subset of the total. And this is a very important one. ICU is just representing obviously the more severe cases. But here you can see we've been reasonably flat since the second week of April. And this is what is an encouraging trend. We wish this trend was going down, but as you'll see in this one, so now what this represents is this orange line represents the combination of ICU and hospitalizations for COVID positive. The teal line here represents everyone who's in a San Diego County hospital for any other reason. And then this is the total number of hospital beds being utilized on each day. The dotted line here is current bed capacity. It bumped up a little bit. A couple smaller hospitals started reporting. This is what's really important, is the delta between these two. And so we expect as we begin to move forward, even if we did nothing different in terms of COVID need for hospitalizations, a lot of folks have not been going to the hospital because they don't feel it's safe, or we've encouraged people, to generally avoid them. This number is going to go up a little bit, just from people who need to go to the hospital going back to the hospital. The other thing is, as hospitals begin to bring back elective procedures, and the thing with elective procedures is you can delay them for a while, but at some point an elective procedure becomes a required procedure. It becomes mandatory. And so hospitals are beginning to bring those back up. Then this line is going to start increasing. And it's the delta between these two that we really spend a considerable amount of time working on. So that's a kind of bare bones, quick kind of where we are, what we're looking about, what we're thinking about. And then in terms of opening, the governor, again, through his executive order, established what's essential, what's non-essential. They have a stage 1, which we're in right now, a stage 2, a stage 3, and a stage 4. Stage 4 representing vaccine, therapeutic treatment. Stadiums are open, bars and nightclubs are back, everything's back to normal. Stage 2 representing those lower risk entities, either lower in intensity of contact or lower in number of contacts. And then kind of, I think we'll end up working our way through different iterations of stage 2. Stage 3 representing some more higher risk entities, and then 4 being good. The governor said that on Friday, counties can move into the beginning of stage 2, opening up certain retail that can do curbside delivery. And then again, he's alluded to perhaps giving counties the ability to move a little deeper into stage 2 with some additional industries, provided they can self-certify to a criteria that has not yet been defined. So we're waiting to see what that criteria is, and we're waiting to see what those additional industries would be. We have put out some guidance to employers for things that they should be thinking about, either as they operate now, if they are essential, or as they begin to operate, as they become essential. And it's really hard in an economy as dynamic and complex as ours to put out a series of things that encapsulate every possible scenario and situation. And so what we're trying to do is provide some general frameworks, right? And some general frameworks are, as you begin to open, continue to telework where feasible and where you can. As you do have folks who physically come to work, you will need to do a temperature check upon entry. This is kind of a hallmark of what we do to try and stop the spread. It's a contactless thermometer. You check your employees' temperature when they come in. If they have 100 degrees or higher, you send them to get tested and you send them home. If they're under 100, then they come in and they go to work. In the workspace, you physically distance as best as you realistically can, given the unique nature of your job. If you're a hospital, you can't physically distance a patient from a doctor. If you have some manufacturing jobs, it's not feasible that you can physically distance, but you do it as best as you can. And you do things like face coverings, hygiene, different types of things like that. And we have a template that's up on our website for businesses they can download and literally just fill in the blocks about the things they're doing around their efforts around physical distancing and even temperature checks. You can't buy a ton of thermometers today. It's hard to get them. And so we are trying to provide some latitude kind of as these things are practical and as you can do them. But the aim is really to just get us in a mindset of rethinking the new normal, rethinking a posture of limiting spread, of containment. And then as we get spread, we're going to have spread. We just want to contain it to a manageable level under our healthcare system.
So Nathan, a couple of questions. First, on the testing issue, you're running between, around 2,000, a little bit above 2,000. You stated that you want to get to 5,000. So what barriers are in place that's stopping us from getting to that 5,000? And you're also, again, you're testing a biased group. You're testing people who are going to the hospitals who think they may have some symptoms. And I think what you've talked about is we need to get to a place where we're doing some type of random sampling as well. So how do we get from the 2,000 to the 5,000?
The challenge with testing is it's not a pregnancy test, right? If a COVID test was a pregnancy test, we could do 50,000 a day. We could do 100,000 a day. I mean, the problem with the current model of COVID testing is that there are multiple components that are all separate and distinct from one another that all have to be present in order to execute one single test. So to start with, you have to have an individual who has a doctor write them an order to get a test, because you can't just run around and test people. Now, we're working on some flexibility around that. And I think we're beginning to see some progress around that barrier. Then you get ordered a test. Now we have to get you to a place that can do the test. We don't want everyone in San Diego County who has symptoms or doesn't have symptoms showing up at a hospital. That's not a good thing. So that's where we do things like drive-through testing. Well, we have drive-through testing. We've had it for, gosh, probably close to 2 months. We do it at the Qualcomm Stadium parking lot. We have a number of places. We don't always advertise those sites because you can't just show up there. You have to have a doctor order it, and then you get directed there. But then you get to the drive-through test. Now I have to have a nurse who is there who can do the swab. That nurse has to have personal protective equipment because this nasal swab is an aerosolizing event that aerosolizes if you are COVID positive. So I got to have a nurse. The nurse has to have the swab. Now, you wouldn't think nasal swabs are hard to get until the entire planet is all trying to buy nasal swabs. There's a challenge of getting those. That nurse has to have all the personal protective equipment. Then you got to have the tube to put it in. Now you have to transport it to a lab that's going to do a test. When you get to that lab, depending upon the platform, you got to have the reagent component. You have to have the machine. You got to have everything. And if there's any breakdown in the supply chain of any of those pieces, from personnel to PPE to swabs to reagents to testing, then the whole thing breaks. And so we are moving aggressively to plug all of those holes. But you hear there was something that was thrown out a few weeks ago. It was alluded to that in San Diego County, this was a couple weeks ago, we had the capacity to do 4,000 tests per day, which was not a true stat. That was the equivalent of if you had a printer that had the capacity to print 10,000 sheets of paper a day, but you had no paper and you had no toner, you don't really have the capacity to print 10,000 sheets of paper. And so where we are getting to is a point where I believe we will have enough machines that if they have all the components could run 5,000 tests a day. Now we got to iron out all of these other pieces, and we're doing that every day. There's a Herculean effort to try and tackle each of those things. And then it's further compounded by the very fragmented nature of our healthcare system. We have a number of hospitals and a number of clinics and all of these things that all have to be coordinated in a seamless way. The buckets of testing go in a couple buckets. At the County Department of Public Health, we can do about 1,000 tests a day, and we are ramping up to maximum capacity there. We are primarily going to focus our 1,000 capacity on going to every congregate care center in San Diego County and test every single person there, every resident and every staff. And when we get through them all, we'll go back and test them again, because those are the folks that are highest risk: assisted living, skilled nursing, all of those types of facilities. Then we are also going to utilize our tests to do mobile testing in vulnerable or underserved communities. These are areas that don't have access to testing. They don't have good access to healthcare. We will go down and try and meet that need and address that concern. Then we have our hospital partners who do tremendous testing now. Each of them does their own testing. They report their results to us. We're working with them to say, what is your barrier? Is it personal protective equipment? Okay, we'll give it to you. Is it staffing to take the swab? We'll give you that. Like, what is each one of them has a different barrier. What is your barrier today? How do we address that barrier and get that done? The third component's the commercial labs. They operate a little bit more independently. We kind of just get the results of what they get ordered. And then the fourth one is one we stood up this week, which is the state of California in partnership with Optum is doing a drive-up-ish testing at 3 different places, one in Chula Vista, one in El Cajon, one in Escondido. And there's a website, which I can share here in a minute, And this testing is available to anyone. You just go on and sign up. There's no charge for it. This they can do right now about 782 tests per day. We think that that will increase and potentially expand to other sites. And so when you add up each of those, I see a clear path where we can get to 5,000 a day relatively soon. I'm talking hopefully within the next week. That doesn't mean it will happen every single day, but what we want is a rolling average where we're doing that much. And that again is the floor. Once we get to that, then we want to continue to grow. There is some great promise on the horizon about potential saliva-based testing, about potential tests you could self-administer. But as with everything healthcare related, something that is a promise in our normal world, if someone has the promise of a healthcare related breakthrough, that promise could be sometime in the future. People are moving much faster, but we have to operate with what we know now. The other thing on testing, again, I'm only talking about PCR diagnostic testing. Serology testing gets a lot of attention. It gets a lot of stories in the news. There is a lot of concern about its accuracy, about its validity, concerns about false negatives and false positives. It also tells us if you had it, not do you presently have it, and are you in a transmissible state. And so I think that will have tremendous promise and great utility in a different way. And we have a subcommittee of our testing task force working on that, but our focus now is PCR testing.
Well, Nathan, first of all, I think it's a testament that we're asking a legislator a question on testing and you have a 5-minute answer. So I think that really speaks to how you studied this issue and really have delved in. And that really shows when you give answers like that. So I want to thank you for that. I want to delve a little bit into our next phase of opening up. So this idea of essential has really been left up. That's kind of been the honor code, right? I mean, obviously, you know, the malls and restaurants aren't open, but if you look at the innovation economy, it's, you know, we're trusting you guys to, you know, if you're essential, open, if not, not. And if I look to some of our manufacturing companies in San Diego, you know, it's not easy manufacturing in California. So, you know, those folks, everyone's eager to get back to work, but I think, you know, using those guidelines you talked about, and certainly Tech San Diego is going to see how we can help those companies come in and really kind of audit some of those guidelines to see how we can help. But I would hope in the next phase that there's a little bit of room for manufacturing and high-tech manufacturing that may not be considered defense or, you know, essential, but in California, manufacturing essential itself. So I hope there's a little bit of wiggle room as we go to the next phase.
No, and I think on that point, you know, Kevin, if the basis of how we're moving forward, which is if we had rapid testing, we could test everyone who has a fever or everyone who has symptoms right away, rapid tracing, rapid isolation, and we could operate in a world of utilization, face coverings, temperature checks, physical distancing. If that the sense is, if we did all of those things, then we could contain the spread. If that's true, then that's true for everyone. The challenge is how do we kind of dial in and ease, and the frustrating thing, I'll tell you, you know, in a policy standpoint, is a lot of the decisions that are being made are incredibly arbitrary in terms of what's essential, what's non-essential. It's also very difficult to you know, outline, you know, broad category. You know, when we say we want to loosen up outdoor recreation, well, does that mean going to a park or playing paintball? And you know, you get into the kind of what about this and what about that, and it gets really hard. And so in large part, as we turn the dial coming out of this, we're trying to gradually and slowly turn it. But I think a lot of those industries that don't have customer interactions, if they can operate in a way where their employees are protected from one another, face coverings, physical distancing, hand washing, you know, I think those are ones that we want to get up and running. The other challenge that we don't talk about it a lot is that, you know, you see protesters and you kind of see that going on. That's a very small percentage of folks in general. Recent polling I just saw said, I think it was close to 80% of Californians want to stay at home because they think that there is a danger. And so as we reopen the economy, we have to simultaneously convey, we have a plan in place to preserve the integrity of our healthcare system. And if you get sick, there will be help available, because otherwise you could see a situation where you could open things up, more consumer facing things, and nobody would show up. And so it really takes doing both things simultaneously. And then the other piece of it I've been spending a lot of time on, particularly in the last week, is how do you have, if the schools are closed and your parents are going to have to go back to work, what are the childcare options that are available? And we have to get some of those back online. If schools in totality are not going to be able to open, I've been working a lot with YMCA summer camp. How do we create some parameters and structures so that there's childcare available too? And so, I think you're right. I think things like manufacturing, things like tech are not things that are consumer facing. And I think those are things that we could do with lower risk because there's lower exposure. And I also believe that companies are going to do right, particularly our tech sectors, by protecting your workers, because it's the right thing to do, and it's also what's going to keep your workforce healthy and not sick. And if you look at what's happened in some of those Tyson factories, and no one's man, that's really bad for business. It's bad for your workers. It's bad for business.
I think
we're
Nathan,
less about the compliance side by business. I think if we put the guidelines out, y'all are pretty good at taking them, figuring out how to adapt to them, how to make them work for you. And I have great faith and confidence that that will happen.
well, I think that's a good approach. The daycare issue spans socioeconomic range, and it's interesting. Tech San Diego has a suite of roundtables where the peers get together, CEOs, CFOs, and when talking about working remotely, that constantly comes up. I can't send my kids to camp, let alone the school's out now. It's summer, and my kid's in camp, and he's doing all these other things, and I can't go back to work. And so, sometimes I think there's a perception that they only hit certain socioeconomic segments of our community, but the reality is they hit everyone. I also want to applaud, Nathan, your work on really addressing that. I know that there were some contentious issues within the county supervisor meeting yesterday, and so I want to applaud your kind of drawing attention to that issue.
No, and that is, look, that impacts us all. Look, my wife and I are going through this right now. She's a legislator. She has to work. I'm a county supervisor. I'm here every day. And 3 of our 5 are still at home, and they're home. And so figuring out, and my wife has taken the 99% of the burden, because I'm at the emergency operations center every day, of arranging 3 different kids in 3 different grades with 3 different Zoom call, assignment here, assignment there. How do you make it work while also trying to do a job? And so it's really, it is a challenge. So we're working to try and figure out how can we bring back on some of those childcare options. And look, it's not going to look the same. We're not putting 200 kids in a gymnasium until we have a vaccine, but how do we reimagine and rethink how we do what we do? And we're doing a lot of work with schools. At some point we'll get the go ahead for schools to be able to move forward. But again, it's going to be different. And I think there's a part of us that have to kind of settle in and accept that for the foreseeable future, we're going to be operating under a new normal. And then the other challenge is at times you just, you kind of run into this mindset that it's just no big deal. And we're over 70,000 Americans dead in the last 2 months, despite having done all of these things. So I think that there is a real public health risk and danger out there. I think we have to figure out how we mitigate it. The other thing we do think about, and this is not lost on anyone here, is assessing the danger from coronavirus, but also the corresponding danger from the measures you take to avoid coronavirus. And that's where, we have to be mindful of that as well, both the economic distress, the mental health anxiety, the isolation. And so that's where, we have to continue to figure out how we can move and exist in a new normal that is just a little bit more manageable than what we went through the last couple months.
So Nathan, what can we do as a tech community to help you?
Well, I think just figuring out, creatively, Kevin, we can send you and you can share with your group this kind of Reopen San Diego basic business safety framework. I think taking that and really thinking about, how you would operate so that, because the other thing that happens is we may not, I was talking to a group and they said, well, you can't just tell us like we can open in 2 days, we need time. And the problem is we can't always predict the future. So if the governor were to come out and say, hey, if counties have met X, Y, and Z criteria, you're good to go on these 20 industries. Well, if we've met X, Y, and Z, and that's where we are, then we're going to say, okay, we've met the criteria, these 20, you can go. It may not be these 20, you can go in 2 weeks, because we don't have any ability to predict the future. And so what I would do is I would start looking at these things and thinking about, how is it if I got the green light to go today, that I would go under these kind of parameters. So at that point, whenever it's ready, then you're ready to go. And then it's going to look, this is going to change. I mean, we haven't gotten on an airplane the same way we ever did since 9/11. Like, this is going to change us in a way. I think telework, telemedicine, teleeducation, those things are going to be a bigger part of our life in the future than they were in the past. Hopefully things like physical distancing and stuff will be less lasting, as we move forward. But I think just thinking about, how it is you would operate in a way that makes your employees feel safe and comfortable, and where you can be profitable and fulfill your mission. And then just be patient with us a little bit, because it is it's a challenging situation where you have so many things that are uncertain, so many things you don't know, and so many things you're daily trying to get a better handle and picture on. And so I know it's hard, and I know it's frustrating, and I know sometimes you get conflicting messages maybe between state and federal officials and other types of folks. But just, as best you can, try to be a little patient here. Nobody wants people to get back to work more than me. Nobody wants kids to get back to school more than me. No one wants any of that. We just have to balance all of that with the public health danger we all face and try to get out of this the right way.
Good. So I want to make sure, Sarah or Heidi, who's on, did we miss any questions that people were asking?
Oh,
Hi,
I see.
Sarah.
Look like it.
We
So
have
go ahead.
it looks like all of the questions have been answered. I think the one question was that I didn't hear an answer to was, do these stats and goals include the VA and or military?
That's a great question. The current bed capacity does not include federal hospital system. And so the hospital stats do not include them. The positive cases do. And I know that doesn't make a whole lot of sense, but because San Diego County residents, all residents have their positive and negative cases reported to us. The VA military ones are reported in our positive cases. They are not reported in our hospitalizations because their hospital systems are unique and separate. We do coordinate with them. We do talk to them. Both the VA director, along with Balboa and Pendleton hospitals, are on all of our hospital calls, and we do work with them, and we think there'd be opportunities if needed. So the short answer is positive cases do reflect every San Diego County resident. Hospitalizations do not reflect federal hospitals.
So Nathan, first of all, I love your 2:30 briefings. I usually just watch them on Facebook. Where else? Where can people watch your 2:30 briefing?
I don't know I don't think stations are carrying them live anymore. They're on Facebook and Twitter. They're on both of those entities, and that's, those are just daily briefings. Supervisor Cox does a quick thing. I kind of walk through major announcements we have. We walk through the numbers. Dr. Wooten does a public health officer's report, and then we take press questions. And so some days, today we don't have a lot of major announcements. Today it's more kind of an update. Someday we have major announcements, but you can watch those and you can watch the back ones. And then I try each day to do a little separate one on my personal Facebook towards the end of the day. Sometimes just a little bit more information. We don't have the same time constraints.
I think that's the one I've been listening to.
Yeah, so the one I do on Facebook usually is sometime around, it depends on the schedule for the evening for what we have. So somewhere between 4 and 6 p.m. On my personal Facebook. And then the county ones, the official ones we do for the media, are at 2:30, and those are on the county's Facebook and the county's Twitter.
Okay, so I also go to the County of San Diego website and look up the graphs that Supervisor Nathan put out. They're usually out anywhere from 4:30 to 5:30. I've been noticing they've been live there, so I check on that. But Nathan, I do want to give a very heartfelt thank you. From the beginning of this, you stood up at the County Emergency Center. You've been a great face for what's going on in San Diego, and I just want to thank you for taking time out of your schedule. I know you have little ones at home, and I'm sure you have lots to do, but really taking this issue and understanding it. And we're all going to get to the other side of this, and we're going to go to a ball game when we get to the other side of this. We'll go to Petco Park, and we will watch that game. So I know you have to do some preparation for your 2:30 meeting, so we will let you go. Any parting words to us before we let you go?
No, I want to thank everyone. The good news, I'll impart to you two pieces of good news. We don't talk about good news very often. The first is this generally only happens about once every 100 years. So hopefully those of us on this call, hopefully we don't have another global pandemic of this size. And the second thing is there has been a real sense of community, despite all the, again, kind of the stuff. We're never going to enforce our way through a situation like this. It's just simply an unwieldy, unmanageable situation. And so what we do ask is for, the public to join us in these efforts. And the things that we're asking folks to do are not things because people really get joy in telling people what to do. That's not the case. It's because these are things that protect one another. And I am encouraged to see the widespread compliance and adoption when people realize their actions will save the life of someone else. And so we just ask for your continued patience, your continued help in all of those efforts. I just real quick, Kevin, I saw two things, questions on here. I just looked that I didn't just popped up. Will hospitals be able to open for non-critical services? We did lift the restriction on electives, so hospitals now can begin to do those based on their own assessment of their staffing, their PPE, their capacity, and so we are beginning to see some of that. And then the other one surrounding the situation in Mexico, and I just want to allude on that one really quickly in closing. I am very concerned about the situation in Mexico. It was 8 weeks ago, I was on a call with the governor of Baja, pleading with them to take this more seriously, pleading with them to mirror a lot of our actions and steps. We did not have success in having that message conveyed it. We conveyed it in a meaningful way. We didn't have success in having them act on it. The situation in northern Baja is very concerning, both the number of cases and healthcare system integrity. And the concern to us here is there's probably 240,000 individuals, U.S. citizens, U.S. persons, permanent residents who work in San Diego but live in northern Mexico who routinely cross. And so we are working very hard. We've made motel rooms available for any healthcare worker who resides in Mexico who doesn't want to go back and forth. We're working with the state and federal governments to try and get more help and support. The best thing we could do is solve the problem on that side of the border and help there. We're working with CBP upon screenings for crossing the border. We're working to get more testing and more supplies to our South County hospitals. Sharp and Scripps in particular have seen increased utilization of their hospitals in South County. So we are mindful, we're aware, and we're doing everything we possibly can to address it. So again, just, thank you all and appreciate your patience as we all try to work through this together.
All right. Thank you, Nathan. And we'll be ending this webinar. Go to techsd.org and we will put, Nathan, we'll put your county recommendations on opening up. That'll be on our website today.
Sure.
And you can visit it often to see what we have going on. And we'll catch up at a later time, Supervisor Fletcher.
Thank you. Thanks, everyone.
All right, thank you.
All right. Thank you so much, everyone.